Yes, ma'am.
Hi, Congressman. Thanks for doing this today. I am a physician. My name is Dr. Josephine, and I'd like to clarify a couple of things. First, I'd like to clarify this, what you just mentioned, and then maybe take the conversation in a slightly different direction. There's a $50,000 excise tax on charitable hospitals that fail to meet, quote, community health assessment needs, financial assistance, and other rules set by the Health and Human Services Department. And I do feel that that's the type of language that's thrown all over this bill, which I downloaded and read, which while the bill, yes, it gives coverage to people, it actually goes out of its way to throw language like that, which limits actual delivery of health care. So I feel like that's a type of double talk. And I also feel like that's a type of discrimination.
I completely missed what you just read.
Okay,
you
sure.
mind reading
In
it?
fact, I have papers here. I can put them on the back of the table.
Yeah.
I actually gave some to your help.
Could she speak in the microphone, please?
Sure.
We can't hear you.
Not used to talking in a mic. A $50,000 excise tax on charitable hospitals that fail to meet, quote, community health assessments, financial assistance, and other rules set by the Health and Human Services Department. So that's the type of language that, while, you know, we all hope that people who want to live their religion will be able to live their religion, and yet we have that type of language that's in here. We also have language, other type of language. Let me see, there's, anyway, the thing that I'm really concerned about is that it's going to get in between me and my patients, basically. There is language in there that the board that's being set up will be able to deny coverage based on claims of insufficient benefit. So for me, my interpretation of that is that if, you know, patients who do not fit the quality adjustment life year spectrum, in other words, the elderly, the people who have some type of issue, perhaps even the very young, such as premature babies, etc., if there's insufficient benefit to that patient will be denied care. So that's the type of language that's in here that I find very disturbing as a physician. So my question then, since I have to ask the question, is what type of fix then are you going to try to figure out, since this healthcare bill is really all about getting the fix for the companies to get out of it, getting the fix for various religion institutions, getting the doctor fix in so that they can actually take care of the Medicare patients. What kind of fix are you going to offer my patients then?
Yeah, okay. I'm not 100% sure what that line you were reading about. It sounded like there was a penalty on hospitals that didn't do an adequate job
Don't fit
serving.
a certain
Let me answer your question more broadly, though, because we probably shouldn't litigate one particular line in the bill. Look, on all of these things, there are powerful competing interests. So you heard me now just articulate a constitutional belief around protecting conscience. By the way, and I didn't mention this, and I should have we have a profound, from a public health standpoint, interest in making sure that every woman who wants access to birth control can get it. And that's on the other side of So I'm just trying to make a point here.
We're talking about access.
Okay.
Well,
Who's talking about access?
Right, it's not a problem.
So,
Plenty of access.
So, you know, we don't necessarily need to have this as a fight. And that's why you heard me say practical solution. Because if I'm a woman working for St. Vincent's, as a guy who cares deeply about the Constitution, I want to preserve St. Vincent's right of conscience. But we have a deep and powerful interest in having the woman who works there, who wants access to birth control, have it in an affordable way. And you're a doctor, so you understand the incredibly compelling public health reasons why we want that to be true. So the answer has to be some sort of practical solution. Now, I do want to get to the second part of your question. You made reference, I think, to the Payment Advisory Board, which would, in some instances, make decisions about what the Medicare system in particular pays for. And you said it will make judgments based on what is effective. So let me ask you a question. do you envision as a doctor a world where because who pays for Medicare? Everybody in this room pays for Medicare, where a Medicare patient can come to you having been educated on 1 hour on WebMD and says, I just heard that cinnamon bark is really good for my headaches. Can you please prescribe me a $20 cinnamon bark medication? I think we'd all agree that the answer to that question is that unless it has been shown scientifically through evidence that cinnamon bark is good for headaches, maybe collectively the Medicare system shouldn't pay for it. So what we pay for through the Medicare system, which is all of our money going into a pot, I suspect most of us would say we want that money going to treatments and drugs and other things that have been shown to be effective. Yes, ma'am.
Hi, I'd like to bring up the question of the First Amendment to the Constitution, which says that Congress shall pass no law prohibiting the free exercise thereof, referring to religion. In the Obama tax bill, it is specifically denying any religious institution, unless they are totally religious, in terms of who they employ, etc., the right to exercise their religion by forcing them to provide abortion, contraception, and sterilization. That bill, that has been challenged by many people, and I'd like your thoughts about how that is limiting the freedom of religion in this country.
Sure, thank you for the question. The lady, I'm sorry I didn't get your name, refers to a controversy that really got heated about 2 months ago, where not the Catholic Church, but Catholic affiliated institutions, Georgetown University, St. Vincent's Hospital, affiliated institutions might be subject to the mandate under the Affordable Care Act to provide health insurance to their employees that would potentially include abortion, birth control services. Couple of clarifying points. Religions, in other words, the church itself, synagogue, religions are explicitly exempted on conscience grounds from that mandate. Where it rose up was, what about in these affiliated institutions, where if you work for St. Vincent's Hospital, you're a nurse there, you could be Jewish, you could be anything, you're not. It was a little bit more complicated. And originally the administration came out and said, no, those institutions are going to be required to provide birth control, for example, or health insurance that has birth control. I will tell you, you asked me what I thought about it, I was uncomfortable with that stance. I take very seriously what is known as the conscience clause within our Constitution. In fact, I see one of my friends here with the Christian scientists with whom I've been working to get on some legislation that would make a carve-out exemption for Christian scientists who want an exemption from the requirement to buy insurance because it's at odds with their religious beliefs. So I actually came down personally on a slightly different place than a lot of my fellow Democrats came down on, which is that the right to conscience is constitutional and important. And I told the bishops in this case this, which is, let's find a practical accommodation. In other words, let's not have the mandate weigh heavy on St. Vincent's and Georgetown, but let's have a practical accommodation so that if you're a woman working at Georgetown or at St. Vincent's, there's a separate deal. You can go, and I'm just making stuff up here now, but you can go down the street to a pharmacy where there's a deal cut where you get reasonably priced birth control, for example. So that's where I came out. And at the end of the day, I think that's where we're going to end up, that there's going to be a practical accommodation where these affiliated institutions can feel good. Now, unfortunately, you know, again, in the election context, things got a little overheated, and there was the war on religion and this stuff. But this is a key issue. It really, and by the way, for those of you who are lawyers in the room, there is a long history of jurisprudence in this country of trying to find exactly that line where you can say, you know, no, you can't provide this health care to my child because of our conscience. It's an interesting topic, but I do think that at the end of the day there will be a practical accommodation made to allow for the Catholic affiliated institutions to be more comfortable than they are today. By the way, I'm on the verge, we haven't had a chance to chat about this, but I'm on the verge of co-sponsoring some legislation that would create a conscience exception for the Christian Scientists. Sorry, I just marched in 90 degrees in a 2-hour parade in Bridgeport, so I'm probably a little flakier than usual.